Hello everyone, my name is Priya Singh Rangey. I'm an assistant professor at the Rangey Institute of Physiotherapy, and as we have seen my videos, for the past few videos we have been talking about cryotherapy, and so moving on the same lines, today we'll be discussing the techniques of application for cryotherapy. There are different techniques by which we can apply cryotherapy, like ice towels, ice packs, ice cube massage, immersion technique, excitatory cold compression therapy, and CRYOFLOW units. So let's begin with ice towels. When we are using ice towels, we require an ice solution, which is 2 parts of crushed ice or flaked ice and 1 part of water. We require 2 terry towels. We need to immerse these terry towels inside the ice solution, and we need to wring the excess water out of these terry towels, but we need to make sure that there is some amount of crushed or flaked ice that is still sticking to the towel, so that we can get a better temperature drop when we are applying these ice towels to the surface of the skin. We need to apply one of the towels to the surface of the patient's skin, and we need to make sure that the towel stays there for about 30 seconds to 2 minutes. The duration for application of one towel should never exceed 2 minutes, or it should never be lower than 30 seconds. We need to maintain the towel for about 30 seconds to 2 minutes. Once the duration is completed, or we realize that the temperature of the towel has increased, then we need to change the towel, and we need to keep doing this repeatedly for a total treatment duration of 15 to 20 minutes. Another method that can be used for application of cryotherapy is the ice pack method. When we are using ice pack method, there are different options that are available. We can have crushed or flaked ice placed inside a terry towel bag, or an ice towel that is folded into an appropriate shape, or we can have commercially available ice packs, as you can see in the figure. Whenever we are applying ice packs, the problem with ice packs is that it may cause overcooling of the tissues, because sometimes the ice may stick to the patient's body part, and that can cause over cooling of the tissues, and this can be avoided using vegetable or nut oil. When we are applying the ice packs, firstly we need to expose the area that we need to treat. We need to apply vegetable or nut oil over that area. The benefit of using vegetable or nut oil is that because of the slipperiness of the vegetable or nut oil, whatever ice or water has been accumulated between the ice pack and the patient's tissues will drop off from the patient's surface, and this can be accumulated in a gutter like structure that has been created using a polythene sheet. We need to place this gutter like structure beneath the patient's body part, so all the excess water that is drained off from the ice pack, it accumulates in the polythene sheet, and then it is eventually drained off in a bucket that is placed below the plinth. The total treatment duration for application of ice pack is 10 to 20 minutes. Ice cube massage is one of the more convenient methods for the application of cryotherapy. It is convenient because there is no use of an ice box or a different kind of machine. We can use a domestic refrigerator for this kind of application. We can have an ice cube, a large ice cube or block of ice, and we can apply this method using that ice cube. One end of the ice cube needs to be wrapped in a towel, and the other end needs to be free. Using that exposed other end of the ice cube, we need to apply massage with this ice cube in a circular direction over the affected area. This massage that we are applying using the ice cube should be in bouts of 2 or 3 minutes only. It should not exceed 3 minutes, because if we are exceeding 3 minutes, then it will cause overcooling of the superficial tissues and cause damage to these tissues. We need to give some time in between each bout for the rewarming of the tissues, and this needs to be done for 3 or 4 minutes for a total treatment duration of 15 to 20 minutes. This kind of method of application is usually more commonly used for bed sores. It can be used for healing of the bed sores and also for the prevention of the bed sores, because when we are applying ice cube massage, it is going to give 2 kinds of effects. It is going to give the massaging benefits, and it is also going to give the cryotherapy benefits, and ultimately it is going to cause enhancement of the tissue healing and also an increase in the blood supply to the local area, and hence it can be used for both prevention and healing of the bed sores. Immersion technique is also one of the more commonly used techniques. In this kind of method of application, we are using an ice solution that is made up of 50% ice and 50% water. But the only disadvantage of using an immersion technique is that we can only treat distal body parts using this immersion techniques, since we cannot immerse any proximal body parts into the ice solution, and hence only distal parts can be treated. When we are using immersion technique, usually the patient may complain of pain because of the cooling of the tissues, and hence we should usually not use single treatment sessions. But if the patient is tolerant enough, then immersion technique can be used for a single 10-minute treatment session, or it can be given in a cumulative 10-minute treatment session. Excitatory cold is usually used for muscle inhibition. When cold is applied in an appropriate manner, the tactile stimulation that is caused because of ice can be used in order to increase the excitatory bias around the anterior horn cell. It can often produce contraction in the inhibited muscle when used with other forms of excitation like PNF techniques, etc. It can be used for post-operative muscular inhibition or during regeneration of a mixed peripheral nerve. When applying excitatory cold, the first thing that we need to do is we need to identify the root level of the muscle that is inhibited, and we need to identify that the skin that is supplied by that particular root. Hence we need to apply the excitatory cold over the dermatome associated with the affected myotome. In this particular dermatome, we need to stroke the ice quickly 3 times, and then we need to dry the skin. Because of this quick stroking, there is going to be tactile stimulation, there is going to be stimulation of the receptors. This information will be carried by the mixed peripheral nerve, the sensory fibers of the mixed peripheral nerve, to the spinal cord through the posterior horn. The anterior horn cell has connections with these sensory fibers, and with the stimulation of these sensory fibers, with the information that is being carried by these sensory fibers, there is going to be stimulation of the anterior horn cell, and ultimately there is going to be a contraction of the muscle that has been inhibited. Hence the excitatory cold method is usually used for muscle inhibition. Cold compression therapy is a somewhat newer technology that we are using. It combines cold and compression both. It is usually used for acute sports injuries or post-operatively for different conditions, which usually involve swelling and pain. Cold compression therapy can be applied using 2 different techniques. In one, there is a continuous cold therapy device that comprises of a pad which provides compression and which contains ice water that runs continuously through it. But this kind of a technique may cause tissue damage because of excessive cooling. Another technique which is a little more safer than the continuous cold therapy device is the cold compression wrap. Here we are using refreezable ice or gel. This gel or ice is applied to the patient's body part using a cold compression wrap so that it applies both cold and compression together. Since we are monitoring the temperature here, we are using ice that is temperature regulated. Hence a cold compression wrap will not lead to overcooling of the tissues and eventual tissue damage. CRYOFLOW unit is one of the more advanced technologies that have come up since the past few years. CRYOFLOW unit is a unit which usually works on cooling down the free surrounding air using an infrared biofeedback system. It ensures a constant temperature at the treated spot, and this is the most exclusive benefit of this unit, because with the other different techniques of application there is no monitoring of the temperature and there is no maintenance of the temperature at a constant level. The temperature keeps fluctuating depending on the exchange that is occurring. But here with the CRYOFLOW unit we have an infrared sensor. Using this infrared sensor the device can measure the skin temperature, and with knowing the skin temperature, the device can automatically adjust the airflow according to the temperature that we have set beforehand, and thereby it prevents too high or too low temperatures. So these were the different techniques of application of cryotherapy. For further reading, you can refer Clayton's electrotherapy. Thank you.